So, hey, I have a question for you. Is midlife going exactly as you expected it would? Yeah, me neither. And it definitely didn't for my guest today. At 35, Teyonna Bowman was diagnosed with breast cancer. 5 years later, it came back, along with medically induced menopause. Her story is raw, real, and incredibly inspiring because what she has done since her diagnosis to help other women facing early breast cancer and early menopause reminds us all how unbelievably resilient women are. So, if perhaps you have forgotten how freaking magical you are, Teyonna will remind you what you're capable of. Have a listen. Hello, my friend, and welcome to the Belong Wellness Podcast. I am your host, Jessica Long. I am a health coach specializing in perimenopause, a longtime fitness instructor, mama of two littles, and a wife. If you are a midlife woman wondering what the actual F is going on with your hormones, your emotions, your relationships, your career, and your life in general, then you belong here. Join me each week as I share my own personal stories of how I navigate this wild stage of life. I also bring in experts and fellow badass midlifers to share their incredible stories of career pivots, managing relationships, parenting, living a healthy lifestyle, and much more. So listen, if midlife has you feeling like you're just not yourself anymore and alone in the chaos, this podcast is for you. Grab your giant water bottle, snap on your weighted vest, and let's get to it. Before we jump into today's episode, just a quick reminder that I am not a licensed medical care provider and do not provide medical services or advice. The information shared in this podcast is meant to be educational, not prescriptive. Please consult your medical doctor before making any changes to your diet or lifestyle. Also, the opinions of guests on the show do not necessarily reflect the opinions of Jessica or anyone affiliated with Belong Wellness. Teyonna, you are such an incredible woman, and you have been through so much at such a young age. And now you're paving a smoother path for women navigating early breast cancer and medically induced menopause. I'm so honored to have you on the show today. Thank you so much for sharing your story with us.
Thank you so much for having me. I really do feel honored to be here and just to share my voice and perspective in this journey. It's been an interesting one.
Yes, it has. And your voice is just, it's so critical for women going through something similar to hear from someone who's been through it, to hear from someone who is now offering resources to people who are going through it. So I'm very excited to be sharing you with all my listeners and everyone that they know. So I thought we would just start at the beginning of this story of yours, which is I think you got your first breast cancer diagnosis at 35. Is that correct?
I did.
And I remember you saying you did not have a family history of breast cancer. So this was quite a surprise. Can you tell us, how did you discover that you had breast cancer, and what do you remember about this time around the diagnosis?
Yeah, I do not have a direct family history, so doing self breast exams and early screening was never something that was on my radar. I have two kids, and I nursed both of them for a year, and when I hit the 1 year mark with my daughter, I started to just deflate like we do. And I remember putting her down for a nap and just trying to rush through a shower because there's only so much time to get things done when the babies go down. But when I was rushing through the shower, I actually felt a lump on my left breast, and I thought that was strange. It actually didn't scream, "Oh my gosh, get checked," but I just thought, "Oh, that's new. I don't think that I've felt anything like that. I've had clogged ducts before, but this feels a little bit different." I remember just taking note and thinking, let me just pay attention to this and revisit it in a couple of weeks and see if it goes away or not. But it didn't. And for me, it actually wasn't until I started losing hair on the crown of my head a couple of months after I felt that lump that I even thought that I should go into the doctor and get checked, because again, it was not on my radar. I didn't think that anything like breast cancer could happen to me. After getting a referral for a mammogram and seeing that something looked suspicious on the mammogram, and then getting an ultrasound, it was confirmed that I had breast cancer, and I was shocked because I had young kids. I had just turned 35 and I was really active my whole life. I didn't drink much and ate relatively healthy. So it came as a shock and completely out of the blue for me.
Oh my gosh, of course it did. And did you connect the two things, like the hair loss with the lump? Did you right away think that those two things might be connected? Because I think if I was in your shoes, I wouldn't. You're still fairly early postpartum, and crazy things happen when you're postpartum too. So I think my mind would probably have tried to resolve this with that kind of logic. But I'm curious to know if you put those two together.
I didn't because I was thinking, okay, maybe I'm just in my fourth trimester where I'm losing hair. And I had normal shedding, but I just started to have smooth spots on my scalp. And for that, I thought I have to see a dermatologist. But when I was making my dermatology appointments, I also thought, since I'm making this appointment for vanity reasons, I should probably check in with my, gynecologist and just see if anything's going on. And so she did a breast exam for me there and felt the lump too, and thought, it's worth getting checked out. It could be benign, but just to have peace of mind. They thought I was too young as well, but in some doctors' offices may have even sent me away. But getting that mammogram referral is what ultimately did it. And so I don't know if the two were ever connected because I eventually lost my hair because of chemo, so I couldn't see if there was a correlation, but it was the signal that I needed to actually go in and get checked, which is a little bit embarrassing to say, but that was my reality.
I think it's totally relatable because no woman at 35 who has a baby and a toddler would think that this is what her story was. So, of course, in hindsight, we think, oh, I should have known, but really, no. I mean, I don't think anyone in your shoes would have immediately thought that. Tell me what your treatment was. You mentioned chemo. When did that start and what did that journey look like for you?
After I got my diagnosis, I was able to get appointments pretty quickly. And so I had a double mastectomy. I just wanted peace of mind that I wouldn't have to think about breast cancer again. I know that there's no guarantee that breast cancer completely goes away, but at that time I was thinking I can be a worrier, and if I get a double mastectomy, then I'm not going to second guess myself. So I had a double mastectomy. The type of breast cancer that I had was invasive ductal carcinoma, and it was hormone positive and HER2 negative. And so the recommendation after surgery was chemotherapy and then 5 years at least of tamoxifen. So I took tamoxifen for about 4.5 years before my recurrence came in. It was somewhat of a typical track of treatment because the type of cancer that I had, the hormone positive HER2 negative, is one of the most well-researched breast cancers, and the course of treatment is relatively straightforward, but it was tough to manage at the time.
Of course. And can you tell us what that means? What type of cancer you had?
Yeah, so with hormone sensitive, ER, PR positive, estrogen, progesterone positive, it essentially means, and I'm not a doctor, so I'll try and play it back correctly, but it essentially means that the cancer cells in my body continue to grow and thrive in an environment where I was producing estrogen and progesterone naturally. Because I was pre-menopausal, the hormonal treatment to prevent cancer cells from continuing to grow was tamoxifen, because those are hormone blockers. They don't keep my body from producing estrogen and progesterone, but they would keep cancer cells from binding to estrogen and progesterone cells. So that's I think about 60% of the cancers that are diagnosed, and it's very well researched.
Okay, thank you for explaining that. So the tamoxifen was supposed to help prevent a recurrence by preventing that binding, as you're saying, but you had a recurrence about when you turned 40.
Yeah, so I had kind of gone on with my life and had started a new job, was taking the tamoxifen. And before I turned 40, I wanted to just get into the best shape that I could possibly be in. So I remember doing a couple really hard workouts and feeling sore and like I really nailed my workouts. But after the soreness across my body wore off, I noticed that I still had some soreness in my left breast where I initially felt the breast cancer. With that soreness, I did another self-breast exam and felt a lump again, which was shocking because I had all of my breast tissue removed with the double mastectomy and my margins were clear. So it just did not seem like it was possible to get breast cancer again in the same place. What wound up happening was that the breast cancer that I had actually came back in my skin and in my chest wall. But because it was in the same place, it was considered a local recurrence, not metastasis. So the course of treatment was different the second go around. I had surgery again. I had 25 rounds of radiation. And then I switched from tamoxifen to ovarian suppression to just shut down all hormone production in my body. And I take aromatase inhibitors, which prevent production in any of my other organs. And so it's complete hormone deprivation to try and reduce the risk of another recurrence. And then I also took oral chemo for 2 years because the type of cancer that I had was still early stage, but it was high risk. And for early stage, high risk, hormone sensitive breast cancers, there is an oral chemo drug that is now recommended for most women who are diagnosed.
How did that treatment go for you versus your first round of treatment? Was there one that felt better in your body versus the other, for lack of a better question?
Yeah, no, it's a great question. And this will sound a little bit crazy, but the second go round was harder for me. With the first round of chemo, I didn't get super sick. I was just extremely fatigued, and that fatigue lasted for maybe a year after treatment ended, but I was able to manage it. With my recurrence, I really struggled with radiation. I had some burns on my skin. My skin got infected. And then the ongoing effects and changes of ovarian suppression and the oral chemo on top of that were just really challenging. It wasn't just fatigue. It wasn't just hair loss, but it was also emotional changes that came along with it. And I found that challenging because I didn't completely lose my hair. I didn't look like a cancer patient the second go round. The radiation wasn't visible to the world, but I struggled and felt a little more lonely that time because it wasn't as visible to the outside world.
Oh, that's so interesting. And it's so true. Like, you probably get a very different response from people who can visibly see that you're going through trauma versus if you look fine, they're going to treat you differently. But you might feel like you're saying, like, it was even harder on the inside the second time. And that medication put you into medically induced menopause. Did your doctors tell you that that was going to happen and walk you through what to expect? Did you feel like your expectations were set, or were you taken by surprise by some of the symptoms that you felt as a result of that?
Answer is yes to both of the questions. So my team did tell me that I was going to be in medically induced menopause once I started ovarian suppression. And they explained that I would have hot flashes, and we would also monitor my bone density because it would be very likely that I would see declines from a bone density standpoint and potentially have some joint pain. I did not understand how far-reaching the symptoms of medically induced menopause are, especially for me, because the types of symptoms that I had were beyond what we discussed in my initial appointments, to the point where, and I have a wonderful medical team. I don't want to misrepresent that, but to the point where I was getting dizzy spells and I was afraid to drive. And when I brought it up to my team, the first conversation that we had was around potential metastasis and getting a brain MRI and trying to figure out what was going on. My results came back perfectly fine, but then I just started to read and look things up to try and understand what was happening, and started to learn that benign vertigo could be a symptom of perimenopause or a menopausal symptom. And then I was having heart palpitations. And so I got, an EKG. I went into the ER because that was so scary and we were trying to figure out what was going on. Sometimes heart palpitations can be symptoms of the perimenopausal journey or, what women experience post-menopause. And so I wasn't associating a lot of the immediate changes that I was experiencing after I started ovarian suppression with menopause. When I was experiencing changes, my mind initially went to, oh no, is this a recurrence? What's happening? And just having that anxiety going in for all of these extra appointments. But it wasn't until after I started listening to more webinars and podcasts and reading books that I started to put some of the pieces together that the menopause journey is very diverse and the symptoms can look a ton of different ways. And I started to realize I'm experiencing these symptoms and it's not a reason to freak out, but I just need to listen to my body in a totally different way.
This is exactly why I'm so glad you're sharing your story, because you had to go do some of your own research to piece the puzzle together to understand this is what was happening. And of course, given the situation you were in, your mind would go to the worst place and be very stressed out and concerned that this was something really major. And I mean, you even hear women sharing their stories today who don't have major health issues going to the ER because of their heart palpitations or because of their vertigo. So I can only imagine the 10x on that for someone who was in your specific situation. And so I'm so glad that you're sharing this with anyone who's listening, who has been diagnosed with breast cancer early or is on the precipice of medically induced menopause or has gone through it themselves and is still trying to piece together their puzzle. This is why we talk about these things. So thank you for sharing so openly with us. It's super important.
Absolutely. I mean, I will say that in some ways it was so frustrating and scary when I was doing the deeper dive to understand what was happening. But once I started to be able to put some of those pieces together, it was almost like a silver lining because I thought to myself, oh, I can associate these changes, these physical changes, some of the emotional changes with mood swings, and then my libido completely tanking with ovarian suppression. Like I know that these things have to do with it. And it actually gave me a lot more empathy for women typically go through perimenopause over the course of multiple years, but can't pinpoint why these things are happening. And sometimes the symptoms are severe and sometimes they're just a whisper. And it may not even warrant asking a question. So it gave me a bigger sense of empathy, even though it was, a struggle to deal with those things overnight. And I think that's what started getting my wheels turning on, like, okay, we need to talk about this a lot more.
Well, and you turned your empathy into a mission. You've now started a platform called Pausitive Outlook that helps women who have early diagnosis of breast cancer and or medically induced menopause, and you're giving them information and resources. So can you tell us a little bit about your platform and what precisely you offer and who it's for?
Yeah. So with Pausitive Outlook, I stress the importance of early detection and provide education around that through some of the volunteer work I do and through talking about my own story and how finding my breast cancer early is really why I had optimal outcomes. So early detection is one of the things that I focus on. And then I share my journey from a medically induced menopause standpoint, and some of the doctors and resources that I've been able to benefit from, and hopefully women going through this journey will be able to benefit from as well. And then another piece of Pausitive Outlook is around creating community and having events where women are coming together outside of typical webinars or even the doctor's office and crafting together and just having a fun time, having brunch together with a doctor in this space and other professionals who are trained in menopause and creating a space where women can ask questions comfortably and feel safe and have fun at the same time and leave those events feeling a lot more empowered about questions to ask the next time that they go into their doctor's appointment, and products that support the journey. Because I think that when we are talking about menopause in casual ways, and we're sharing how it's impacting our lives on a day-to-day standpoint, and some of the things that have worked or not, and when we're bringing doctors in beyond 15-minute appointments, and we can connect as women, it creates a spark and hopefully motivation to be more proactive about the changes that are happening in our lives, and how to address them.
And sharing personal stories, because you never know, that one thing, that one little thing that you might say might completely change someone else's experience, because it will help them connect the dots for themselves. So are you hosting just in-person events, or is this available virtually as well? And if you're in person, where are you located so people can find you?
They're in person, and all my events have been in the East Bay. I've had events in Pleasanton, Walnut Creek, and in Danville, and will likely stay in that East Bay area, but they're twice a year, and I do have a website and a newsletter, and send out updates for when they're coming up.
Okay, awesome. Thank you. And I want to know, what were some of the tools or mindset shifts or mantras, or really anything that helped you get through your treatment and get through those early stages of menopause that sound really challenging?
Yeah, I mean, it's ongoing, it's iterative, but what I have found has helped me the most is really hard workouts. What I needed from a positive self-talk standpoint came from a lot of those workouts, and so getting back into that because of the protective benefits of weightlifting, and really the benefits of exercise, especially for breast cancer survivors, and reducing recurrence is important. So working out, lifting heavy has been very helpful. I've gotten into more of a yoga practice that also helps with my balance, and just meditation types of aspects. So yoga has been critical, and I also really cherish my mornings for journaling and setting my intentions, reading my personal mantras as well at the beginning of the day, in order to get my mind in a great space. And then I would also say that sexual health and wellness coaching helped me. As a breast cancer survivor, one of the things that I've noticed after talking through it is that surgery, it is an amputation. I mean, it changes things. Nerves are severed and feeling is lost. But I didn't realize that I lost my mind-body connection very early on in the process, with thinking about my body as just something that needed to be fixed. Ripping my shirt off whenever I went into the doctor's appointments, I really kind of dissociated from the sacred parts of my body. And it wasn't until I did sexual health and wellness coaching that I realized that I wasn't feeling my breath. I wasn't appreciating the new phase that I was in. I was still kind of in this separate space, and being able to make that connection again, as a breast cancer survivor, looking and feeling different than I did when I was first diagnosed, was so incredibly important. And that was a tool that I didn't think that I needed, but it's been huge for healing.
Oh, yeah. And what you're saying makes so much sense. It's like a coping mechanism that you try to separate from your body, because your body is something that, quote unquote, needs to be fixed, right? So you have to almost separate yourself from it to try to fix it, so that you're not too close to it. So you can almost try to maintain some sort of mental control. I could totally see that. And what you're talking about is making me wonder, did your sense of womanhood evolve? Did you ever feel like you lost it, or has it changed at all since you've gone through this journey?
Yeah, I mean, it has shifted and evolved, but I do think the challenge, kind of going to that dissociation and womanhood, is just like, what does connection and sensuality mean? Because the things that worked for me before I was diagnosed don't work for me anymore. And this journey has been one that I've gone through, but it's been one that my husband has gone through as well. He's my best friend, and we communicate so well, but we had a really hard time after both of my diagnoses when we lost our physical connection, and I didn't know what it would take to be connected. There are so many other ways to connect. And so my husband and I have really had to work at that. And I feel more connected to him and to myself than I have pre-diagnosis, but it's taken a lot of work. It's definitely been a process. And there are so many emotional changes that come with a breast cancer diagnosis, and then also just the hormonal shifts of medically induced menopause that are really hard to navigate. And I'm feeling good, but I'm still, making the decisions each day or doing things each day to stay connected.
Yeah, of course. I think it's not something you just leave in your past, right? It's kind of with you as far as the decisions that you make for yourself, for your family, for others, probably forever. And not always in a negative way, but like to your point, you're feeling more connected to yourself and to your husband now than you ever have. I do want to talk a little bit about your recent trip to Washington, D.C. Can you tell us what you were lobbying for on Capitol Hill?
Yeah, so as a result of being a part of the cancer community, I'm a volunteer for the American Cancer Society Cancer Action Network. And during my recent visit to DC, we were lobbying for funding at the highest levels for cancer research through the NIH. And early detection for breast cancer and funding to support research on cervical cancers as well. We were also lobbying for multi-cancer early detection blood tests that will help us detect up to 50 different cancers early that currently don't have screening mechanisms. Right now, only 5 cancers are able to be detected through a blood test. So we lobbied for that, and then also to extend some of the tax credits for the Affordable Care Act, because so many people are impacted by cancers, and cancer doesn't discriminate whether we have insurance or not. So it was a very rewarding trip. I felt very much alive. The things that we were talking about to Congress were nonpartisan. We're just trying to keep cancer research and the human up front, regardless of where people fell on the aisle. And it was exciting because the day after our lobby day, we found out that the multi-cancer early detection bill that we were lobbying for had passed through the Ways and Means Committee and is going through the process. So it was just reassuring that we all have a voice. We can all, push for legislation that's going to help improve our overall outcomes. And I think that being able to do that was a gift. And it's also something that I value and focus on with Pausitive Outlook, especially as we think about how menopause care is shifting and how menopausal education across providers is something that still needs to be prioritized. And there are ways that we can just, call our congressional leaders and make sure that we're signing petitions and moving forward proposals to make menopause care and early detection for breast cancer in the forefront and improve quality of life for women, not only in this generation, but for generations to come.
How gratifying what you accomplished. And thank you for all your advocacy work for all of us. And you're right, our voice matters. Imagine if every single woman right now in the middle of perimenopause or menopause would go call their congressperson or sign the petition. I mean, there's a lot of us. We can make a difference. Thank you for reminding us of that. So we're going to wrap up, but I do have a lot of listeners that are in the perimenopause phase right now. I'm curious to know if you have any advice for them just around the hormone fluctuations and the symptoms that causes through perimenopause and menopause. What's your advice for those of us for how to get through it?
My advice is that it looks different for everyone. Just try and have grace for yourself going through the process. What works for one person may not work for you, and vice versa. But there are so many menopause conferences where doctors of different disciplines are talking about hormone options, non-hormone options, and how we can be our best advocates. So I would say social media can be a little bit confusing because there are a lot of voices, but I guess the flip side of that is just 3-4 years ago, we weren't really having these conversations. And so having additional perspectives is an opportunity to just listen up and see, hey, does that resonate with me? Is this a question that I can ask my doctor? Does this make sense? Should I go deeper? And so, take advantage of the newer voices that are coming out there. If there is a menopause conference coming up near you, I would definitely say join. There's some great organizations as well, like the Women's Health Advocates, that make it very easy to ask questions of our healthcare providers and be our own best advocates. So just keep pushing and listen to your body. Our bodies are very intelligent and should serve as our guide. And I think that if you go into a doctor's appointment, even if it's with a trusted provider that you've had for a long time and they're not hearing your concerns, know that there are telehealth platforms and more physicians who are becoming better versed in what's happening from a perimenopausal standpoint that will hear you. So don't give up, and being the squeaky wheel is a good thing.
Be the squeaky wheel, trust your voice, don't give up. Got it. Love it. Teyonna, thank you so much for sharing your story so openly with us today. I so appreciate it. Remind us where everyone can find Pausitive Outlook.
Yeah, you can find me on Instagram under Pausitive Outlook. I also have a newsletter on Substack under Pausitive Outlook, and so I share resources and tips there. And also talk a lot about younger survivors and what to think about, because just the plug, younger women under 50 are being diagnosed with breast cancer at twice the rate of women over 50 on a year-over-year basis. And so I think it's really important that we're highlighting that, and I talk about that in my newsletter, and also talking about quality of life. So definitely look me up. You can also find me on my website, pausitiveoutlook.com, for upcoming events and what questions to ask your doctor if you are newly diagnosed. So I hope that you check me out.
Thank you. And that's Pausitive Outlook.
Yes,
Pausitive Outlook. All right. Thanks so much for your time. Really appreciated hearing your story.
Thanks, Jessica. It was great to be here and talk to you.
Wow. Teyonna's incredible, isn't she? Her resolve, her honesty, and her compassion are such powerful reminders of what women are capable of, even in life's hardest chapters. If someone in your life has been diagnosed with breast cancer or is navigating medically induced menopause, please share this episode with them. Sometimes just knowing someone else has been there and found their way through can make all the difference. And if you found this conversation as moving as I did, please leave a rating or review for the show. It's one small way you can help more midlife women feel inspired and connected. Until next time, take care of yourself and don't forget how magical you are.